Press the lungs icon on the bottom of the LCD screen. Press and hold the bed up-down button. Caution: only patients sedated and ventilated are indicated for this feature with physician's order. To initiate therapy, all 4 side rails must be up. Secure patient's IV tubing, lines, and drains. Set the desired pause time at each of the 5 pause positions. Press and hold to change the pause time in 5-minute increments up to 30 minutes. Note: pause times cannot all be set on 0 minutes. Set the desired turn angle at each of the 5 pause positions. Press and hold to change the angle by 5-degree increments up to 30 degrees. Note that the inner angles cannot be higher than the outermost angles. Assess the patient carefully for tolerance to maintain hemodynamic stability. Begin at a low angle and advance as tolerated. Note that in the event a patient cannot turn to one side, the angles may be set to 0 on one side until condition improves. See user manual for contraindications. HOB angle cannot be over 30 degrees in this therapy mode. Once the therapy is set, press and hold the test button until all cycles are completed to assess for safety of the patient and bed. Once the test cycle stops and beeps, the play button will appear. Press play to start. Stop therapy at any time using the red stop button. Therapies with rotation over 10 degrees will require packing pillows or pillows to bolster patient. Refer to hospital policy for ventilator-associated pneumonia protocol settings and advanced settings for acute respiratory distress syndrome.
In-bed X-ray imaging is possible with Eleganza 3, Eleganza 5, and Multicare intensive care beds. The radio-translucent mattress platform and an integrated X-ray cassette holder beneath the patient's chest area enable the procedures to be performed in bed with minimum risk to the patient. For optimal results, the patient should be in the middle of the bed laterally and with hips within the points of the articulation area of the backrest located between the yellow indicators of the patient's controls on both sides of the bed. The X-ray cassette holder is located on the patient's left side of the bed and allows for further estimated positioning to align the cassette with the patient's chest. With the backrest in the lowest position and side rails up, insert an X-ray cassette of the standardized format 35 by 43 centimeters inside the holder in landscape or portrait direction. Push the holder back in until the center yellow line indicator on the handle is exactly aligned with the edge of the bed. The holder can be adjusted in both ways, laterally or horizontally. The backrest can also be positioned if the patient's condition allows. With Eleganza 5 and Multicare, the digital indication of the backrest angle on the LCD screen can be used to help adjust the parameters of the X-ray device. Both beds will give a warning in case the X-ray cassette holder is not inserted fully to prevent any damage while positioning the backrest up.
To perform passive leg raise, lower the head of bed to a flat position. Using the up arrow, gauge the knee as high as possible. Then using the up arrow, raise the foot section to the desired height. In-bed passive leg raise will allow assessment of fluid responsiveness when utilized. This non-invasive procedure is performed with sepsis bundles. To activate the vascular position, press and hold the up arrow to gauge the knee as high as possible. Then press and hold the up arrow to raise the foot of the bed.